once it pops up.
Okay. I'm mildly sweating.
You're going to be totally fine. Imagine me in a turtleneck. But I'm not nervous, so. Hey, good afternoon, everybody. This is Brittany Jennings coming to you live from the Seniors Blue Book. And today I have the privilege of hanging out with Riva and Bernice from the Alzheimer's Association. So welcome, ladies.
Thank you. Thanks for coming by.
Absolutely. So I thought I was going to have to pull out a shovel this morning and, get the snow off my vehicle because it's like 60-something degrees in Florida. Or maybe 50s, 59.
It was 56, just, I did check before I went outside today when I was walking my dog.
But you're in a t-shirt.
I know, yeah.
We had to be twins today.
Yeah, exactly.
So I'm super excited to be here with you both and learn more about what you do. I think pretty much everybody has heard of your organization, but I think it's great to break it down and be able to figure out exactly what you do for the community because you provide tons of support. So without further ado, Riva, will you start and tell us a little bit about your background and how you got into the association?
Yeah, so I've been lucky enough to never have a family member with Alzheimer's or dementia, and I was kind of job searching and I found a new memory care facility opening, and for some reason I was like, oh, that sounds interesting, and I started working there, and I developed this passion for the residents, especially those with like the difficult behaviors, as we call it. And I just really connected with them, I think, in a way that some people haven't been able to. So I developed this huge passion for Alzheimer's and dementia, and then I went back to school, got my degree in gerontology, and I found the job for the Alzheimer's Association because I wanted to reach people, I guess, on a bigger level. So yeah, I was lucky enough to start working for them, and I love it.
That's amazing.
Yeah.
I love that journey. That's how I got involved too, as I started working in a community and instantly would start my days. They had memory care, and I started my days in memory care, and I ended them in memory care because it was this passion within you.
Definitely, yeah.
So.
Yep.
How about you, Bernice?
Well, I like to say Riva's our veteran because she's been here for several years. I just joined the association in June. So prior to joining with the association, I worked in international health and development for many, many years. My background is in public health and in nursing. And I moved here to Bradenton a few years ago to be closer to family. And, I kept working internationally with the organization back in Baltimore. And I felt really, though, disconnected with my own community because I worked from home. I didn't really go outside that much. And so I just decided this past year that I really wanted to make a change. So I've been working for 20 years in public health. But internationally.
Did you start when you were 5?
I started.
You
I know.
It's hard to believe. Brittany, you can always come back and visit us if you're going to say things like that. I started very young. I started in the Peace Corps. I was actually in the Peace Corps. And so I really wanted to stay in public health, but wanted to do something domestically. So in my own backyard, for lack of a better word. And so earlier this year, I decided to look for some jobs. And I got really lucky because the Alzheimer's Association had an opening for a program manager. And I don't know if you're familiar with how we're structured, but we really depend a lot on volunteers. So we don't have a lot of staff. We have some great volunteers who facilitate our support groups, who do our community education, but we have very few staff. And so it's very rare to have an opening at the Alzheimer's Association. Yeah. And in some ways I felt like it was divine intervention because my grandmother had Alzheimer's. She passed away in 2013. She lived here in Siesta Key. And I also, when I was a nurse, I practiced bedside care in Baltimore. My favorite patients were elderly patients. And that was the first time I realized I really enjoyed working with older people. Most of my patients were over the age of 80. And they were often in the hospital for one reason, but they often had a comorbidity. So they often had some other issue, which often was a memory issue. And so in that process, I often had to work closely with families to try to give them care because of some of the communication and behavior issues. The families always knew their people the best. Right. And so I just kind of felt like it was divine intervention where I found this job with the Alzheimer's Association at the same time that I was looking for a change and wanting to find something that had more meaning to me locally and,
being in the community.
Yeah, exactly. And I think, Alzheimer's is having a huge public health impact in the U.S., but particularly in Florida, we have the second highest prevalence of Alzheimer's in the U.S. So it is an issue here. So I just felt really lucky to have found the job. So
sounds like a calling.
Yeah, and it's been great. I get to work with Riva every day.
I know about that, Riva.
And then Ryan Smith, who you know as well, who's our development manager, who leads all of our walk activities. So it's been really fun. I've really enjoyed the switch for sure.
That's amazing.
Yeah.
What is it that most excites you about the Alzheimer's Association?
Do you want to go?
Should I go for it? No, you go for it. Okay.
Back to you, Reva.
Let me think. There's so many things.
I know. Well, right now, currently, I'm really excited to work with more of the early stage people, like newly diagnosed or those with MCI or younger onset. I can tell that's kind of a huge need here. There's a lot of people we don't realize that have younger onset Alzheimer's, which is when they develop it under the age of 65. So there's quite a few people in Sarasota, which I guess a lot of us don't realize. So I've started developing support groups for them so they can kind of, connect with each other and talk about things they're all experiencing and get strategies and techniques and everything from each other. So I've really been enjoying that. And we are going to do an art program starting here this month where they can do watercolors, and it's called Memories in the Making.
Oh, I love that.
Yeah, so it's, they're I guess creating memories with paint on paper. So
and it's going to be led by two of our volunteers who have a background in dementia.
Exactly, yeah. So that's really nice. So I'm really excited about those avenues that we're going.
So Reva leads all of our support group activities. So we have I do a lot of our community education, and Reva leads our support groups, and so she's always amazing. She does all of our training as well for volunteers who come on board. I think more than 95% of our support groups are actually facilitated by volunteers, and Reva does all the training for them. Wow. So it's really exciting.
How many, give us an idea, a number of how many support groups there are going on at any time, in a month?
For Sarasota and Manatee, we have about 18.
Wow.
And they're all throughout the day. We've got a couple on Saturday. We're doing a couple on evenings just so they kind of fit in everybody's schedule.
Sure.
And those are just for the caregivers. That's really their time. I always tell them, this is their lifeline. It's your time. It's about you, this group.
Yeah.
And we've got 3 that are for people actually with Alzheimer's in the area too. And we're hoping to add more of those as well.
Wow, that's amazing. 18.
And one of them is at Ross Camp, right? The early stage ones at Ross Camp.
Ross Camp for newly diagnosed people. Yeah.
Wow. Yeah, it's when you said that, it makes sense. I know from my previous field, I helped a lot of people who were experiencing those symptoms at MCI or early Alzheimer's at age 57, 58.
Yeah.
So it's just the baby boomers coming up, and so it's so important, all the innovative things that you guys are doing here.
Yeah, it's exciting.
Yeah.
What about you, What about you, Reva?
You can call me
Reva.
Reva.
Bernice. They're one and the same.
You can remove 20 years off me and call me Reva.
Bernice.
I'm happy to do that. I have to say it's hard for me to make a choice because I'm still so new, and everything that we do is really exciting and new for me. I mean, I think I'm really excited about the Memories in the Making. I think one of the things that really excited me and impressed me when I first interviewed for the position and learned about the Alzheimer's Association is that everything that we do is at no cost to people, which was amazing to me because it is a lot of activities that we offer. So in addition to the things that Reva mentioned, we also have a 24/7 helpline that I find really fascinating because it literally is a 24/7 helpline. People can call at any time for any issue, whether it's something where it's a caregiver in the middle of the night who has they're in a crisis situation, or if you just want to learn more about some rumors you've heard about research.
Yeah, so I can call at 3 a.m. and you're going to answer?
Somebody else, but they're manned by dementia experts, licensed clinical social workers. So it's a really amazing. If people don't know where to turn, if that first step, that's the number to call. But for me personally, I'm sort of our boots on the ground, I guess you could say. I do a lot of our community outreach and education, which I really, really enjoy. It's something that I started doing years ago. It was the first thing I ever did professionally when I got out of university was doing community education, and so I feel like I'm coming full circle to what I really enjoy the best.
Definitely.
Which is going out in the community and meeting people and sharing what I know, but really selfishly I learned so much from them, from the questions that they ask.
Sure.
And so we do different types of education. So we do sort of general public education where we talk about Alzheimer's, the disease, as well as the 10 warning signs. The Alzheimer's Association developed 10 warning signs that can help you kind of determine whether you should go see a doctor to see if maybe it's an issue.
Okay.
And we also have a presentation where we talk about how to reduce your risk, healthy living for your brain and body. How can you reduce your risk? Research is showing now that really that's one of the best ways is to reduce your risk. You can control your own risk to some extent.
Absolutely.
So those things are really exciting for me. I love doing that. So I've told Reva and people who ask me, I'll go anywhere, anytime, as long as people will be there, right? You don't want to go and then no one shows up. I also, one time I went to, I did a presentation for a Professional Women's Association at a restaurant in the evening, and I got a free meal out of it, but that's not the reason why I did it. So that really excites me. We also do a lot of caregiver education. So we do education for caregivers that are both families, so these are people who may be taking care of somebody 24/7, or maybe they're secondary caregivers. But we also do training for people who are, I guess we could call professional caregivers, who work with home health agencies or assisted living communities. They get, on top of their regular training that they get for their licensure, we also provide at no cost additional training if they would like. So
That's amazing.
those are things that are really exciting for me.
It's so necessary.
It is.
You know, I've worked in communities and I see how challenging it can be in certain situations. So to be able to have that extra training, I think people definitely need to know about that.
Yeah, definitely. And then there's one more thing I want to mention is that what I'm probably the most excited about this coming year, once we kind of developed our work plan for the year, is that we really want to try to reach more people in the community who are at higher risk. So there are 3 groups that are at higher risk. Those are people of color, so Latinos, African Americans, they're at higher risk of getting the disease, as well as women. So there are 5.8 million people in the U.S. who have Alzheimer's disease, and 2/3 of those are women.
Wow.
So we want to reach as many people as possible with our programs and services, but in particular, we're really trying to focus on those populations because they are at higher risk.
Wow, that 2/3 number just puts it in
I know.
perspective.
Yeah, exactly.
Wow.
They're also 2/3 of all caregivers, so it's really a disease that disproportionately affects women. So, yeah.
Well, what about some of the events? I know you have a ton of footprint in the community out there, so what are some of the exciting things that are coming up?
Well, just because we were talking about women and because we happen to have a flyer here, we are doing an event on November 22nd. It's called Women Conquers Alls.
Okay.
It's at Water's Edge of Bradenton in Manatee County, and really we're going to focus. Anybody's welcome, men and women, but really it's a focus on women, and we're going to give an update on the most recent research related to women in research and Alzheimer's, as well as talk about the 10 warning signs. So this is one thing that we're going to be doing on November 22nd. I don't know if you want to talk about the walk.
Yes, the walk.
Yeah.
It's
Coming up
Yeah.
on Saturday. So at Nathan Benderson Park, it's beautiful. Every year it's just, it's sunny, it's nice, it's a little bit cold in the morning, but it does warm up. And you can go to alz.org/walk, just put in your zip code, register. Even if somebody can't walk, you can still register to show your support.
Okay.
And it's at 9 a.m.
Not too early. I like that. I'm not a morning person.
No, we have to be there early, but
Yeah, I
I'm
bet.
dragging my
okay.
5-year-old
5
son.
in the
at
morning?
Yeah.
So that's
7.
fun. So it starts at 9, and how long does it go for, typically?
There's a ceremony in the beginning. You get a flower that each color symbolizes, whether you've cared for somebody with Alzheimer's, if you've lost somebody with Alzheimer's, it all symbolizes something. So there's a ceremony where you hold up your flowers and things like that. Really beautiful. So it usually goes, till about 11 a.m. and there's food trucks out there. There's free things, giveaways, stuff like that. So
And there's also going to be, I have a 5-year-old, so this was important to me. There's also going to be a kid zone there.
yes,
Oh, that's
kids,
great.
Yeah.
So they can play there.
Kids, they're gonna have fun too.
And today is Bank Day? Is that right?
Bank night.
Bank
yeah.
night, yeah.
Where you pick up your shirts.
It's at Elon, Manatee. Yeah.
Oh, okay.
You can pick up your shirts, and you can also make a donation right then and there, right?
Yeah, it's like kind of
Perfect.
the early bird check-in type of thing.
Okay,
Yeah.
and what time does that start? Do you know, over at Elon?
I don't know.
Just in case people are watching and want to...
I want to say it's maybe all day, but we
Yeah.
call it bank night.
Yeah. It's
So
all
maybe
day.
in the evening.
I know Whitney's there and Ryan's there now, and so I think they're going to be there for most of the day. Yeah.
Awesome.
To pick up shirts, yeah.
So are those pre-ordered shirts, or...
If you raise $100, you get a shirt, and they're different every single year. So they, they're always purple.
Some
That's
shade of
true, as you
purple.
can see. And these ones say Beast Mode, #NALLS. I love it.
Is that
Love
because
it.
we're in the east? How does that?
Yeah,
Yeah. Okay.
We're the east region.
We're the east region. Yeah.
Yeah.
So that's awesome. So
Yeah.
any other events that are coming up? Or?
Probably, I want to mention that we're going to be doing a caregiver educational series. So we have what we call caregiver colleges, where we provide a range of different topics for caregivers, but really anybody is invited to come. But we're going to be doing it out of Northport at the Shannon Staub Library.
Awesome.
And that's going to be during season from January to April, and we'll be doing that in partnership with the Memory Disorder Clinic with Daniel Valerie and her team. So we're really excited about that.
That's great.
Yeah.
That's great. So, and when you have more information about that, just let us know, because we'll definitely put it up, because I'm sure people are going to be interested in that.
Yeah, that would be great.
Thank
Definitely.
you.
Yeah.
Absolutely. So we'll kind of wrap up. Are there any last, I always ask for, and maybe it's cheesy, I don't know, but any last words of wisdom that you want to leave with viewers? I put them on
You're that than me.
So,
I have to throw a surprise.
I think for me, because I'm on the community education outreach side, my last word of wisdom is that, if you ever have questions or anything, to feel free to come and find us and to speak more openly about the disease. One thing that we've learned with support groups and doing the community outreach is that this disease can be very socially isolating for the person with the disease and their caregivers and families. And so for us, our goal is to really try to normalize the disease as much as possible. So feel free to talk openly or come to us if you have questions so that people can feel comfortable going to their friends and families about this disease. So I guess that would be my last word.
I love it. See, I put you on the spot and you jumped right in there. You did a perfect job. So thank you both so much for your time today and letting us know more about what's going on with you and your organization.
Thanks for coming.
Absolutely. And then I'll get the number from you, like the 24-hour line, and we'll put that up as well on the post. But we hope the walk goes fantastic. If I can pull myself together, I will definitely be there. I won't be there as early as you are, but I'll definitely be there to show my support. So thank you both so much again. And everybody that's watching, definitely reach out to them for more information, or just to, if it's a professional watching, to be able to partner with them as a resource. So I guess without further ado, everybody have a wonderful day.
Thank you. Thanks, Brittany.
Absolutely.